Hi everyone. Vaccine requirements are not new to the field of nursing. Recently, COVID-19 sparked global attention with varying opinions and even controversy around the subject. This is nothing new, with vaccine mandates dating back to the 19th century when smallpox mandates were introduced to several countries. In response to the COVID-19 pandemic, the US government began implementing workplace vaccine requirements in 2021. These vaccine requirements were put in place to help prevent the spread of the disease and to help protect communities. These mandates were often met with resistance and led to debates on individual rights and public health safety. These debates included personal freedom, medical ethics, and public health priorities. Proponents to the mandates often argued that vaccine requirements were essential to help protect vulnerable communities, whereas opponents to the mandate argued concerns over individual liberty and choice. There is, of course, relevancy between vaccine mandates and the nursing profession. The relevant intersections include cultural, socio-economical, spiritual, and ethical factors. We as nurses must ensure that we are navigating these factors with sensitivity, advocating for what is right for our patients, the community, all while upholding ethical principles and the oath that we took upon becoming nurses. Touching on the factors previously mentioned, it is important to note that different cultures may have varying beliefs and attitudes towards vaccines. Cultural competency is often something we learn throughout nursing and should be applied to this matter. With vaccine mandates, there are often exemptions when it comes to religious practices. Socioeconomical disparities can create barriers when it comes to vaccine mandates. This can come in the form of not having available resources to either get vaccines, but can also lead to misinformation or lack of information regarding the efficacy of vaccines. It's important that as healthcare professionals, we make note of these barriers and work towards educating our patients and community, as well as provide resources when possible. Ethically, we must set aside personal biases that we may have towards vaccine requirements and ensure that we are allowing our patients full autonomy while also advocating for their safety and those around them as well as ourselves. Lastly, it is important as nurses that we are staying up to date and informed of vaccine requirements, as we know all too well with diseases such as COVID-19 that things are always changing. This includes requirements, state laws, federal mandates, and the latest vaccine updates. As nursing is not just a singular profession, there are various roles within the nursing field that are involved when it comes to vaccine mandates and requirements. These include nurse administrators, educators, nurse researchers, and even patient-facing nurses. Nurse administrators play a role in vaccine requirements as they ensure that they are implementing evidence-based nursing practices and procedures, as well as ensuring compliance and promoting safety. Nurse educators are essential in tailoring educational programs for healthcare professionals and the community, addressing misconceptions and emphasizing the benefits. Overcoming differing beliefs and cultural resistance may prove challenging for all of these fields, but utilizing cultural competence strategies can help bridge these gaps. Research nurses are vital to ensure vaccine mandates, as they help contribute valuable insights by conducting studies on vaccine efficacy, acceptance, and the impact of these mandates. Their findings help to inform evidence-based nursing practices and policies, as well as provide guidance. We are still reeling from the COVID-19 pandemic and its aftermath, and if it's taught us one thing, it's that although we may have varying opinions on the strategies utilized to ensure that the safety of the patients, communities, our friends, and families, we must do what is right and necessary to save lives. Vaccine mandates help to do this, and by implementing actions such as education, being understanding to the differing views, and willing to listen to those involved in the process, we can help to prevent mandates like this from being needed in the future.